Hi, I'm Dr. Carol White, nurse practitioner for Functional Medicine Partners. We are very excited to be opening in Syracuse, Indiana, and be a telehealth throughout the state in September. This is my last video, which received over 1,000 views. Thank you very much. That was unbelievable. I've received questions about what I'm doing about NHI, my other business, and why I chose to take this leap. So today I'll discuss my education, training, and experience, and then give you my why. I've learned to talk easily about my years as a healthcare provider because I do it multiple times per year for attorneys in either deposition or trial. Here goes. I've been a registered nurse for 33 years, graduated from Indiana Wesleyan University in 1992, and then again in 2000 with a dual master's degree. One master's is in community health nursing, meaning care of the community from a public health standpoint. I furthered my education and then obtained that other master's degree as an adult and geriatric nurse practitioner. Then I went back to school and studied at the University of Alabama at Birmingham and obtained a doctor of nursing practice degree, graduating in 2009. I've been board certified through the American Nurses Credentialing Center for 25 years as an adult nurse practitioner and for 24 years as a geriatric nurse practitioner. I've also been board certified as a nurse life care planner for the last 10 years. And now most recently, my fourth certification is as a functional medicine practitioner. I am licensed to practice nursing as a registered nurse in 41 states, and I'm licensed to practice as a nurse practitioner in Indiana. I've worked in the outpatient, hospital, assisted living, long-term care, and acute rehabilitation settings. My nursing career started in 1989 when I became a certified nursing assistant while I was in my undergrad training. I then took paid student nurse positions as well and worked in med-surg, ICU, and the emergency room. My first licensed nursing position was in 1992 as an intensive care unit and telemetry nurse. I also worked at times in the emergency room. Later, I became an in-service director at a long-term care facility, and I had to get my introverted self in front of people and teach the certified nursing assistant course and teach nurses continuing education. I was scared to death, but I did get over my fear, and I enjoyed teaching, I found out. I then moved into work as a charge nurse of a long-term care facility and then as director of nursing before becoming a nurse practitioner in the long-term care setting in 2000. In 2003, I formed Geriatric Innovations, which is a business for my nurse practitioner services. I was asked to become an independent contractor, so I decided to put that under a business umbrella. In 2004, I started working part-time as a nurse practitioner and added educational consulting services to Geriatric Innovations list of services that they provide. In December of 2004, the company name was changed to National Healthcare Innovations and incorporated under the name National HI Inc., or better known now for most people as NHI. Over the course of the next several years, I presented 8-hour keynote and breakout presentations in 45 states for NHI, as well as consulted with other educational companies and state and national nurse practitioner organizations. My standard care opinions have been published in interview articles of Medscape and Eli's MDS Alert. I published research in the peer-reviewed Journal of the American Academy of Nurse Practitioners entitled An Exploration of Decision-Making Factors Regarding Advanced Directives in the Long-Term Care Setting in 2005. In 2005, I started getting asked to review medical malpractice and nursing home cases for attorneys, which caused me to let go of the educational consulting and focus more on the clinical work and legal consulting. NHI has grown over the years, actually the last 20 years, to become a nationwide practice, employing myself, 2 paralegals, and several contracted nurses. Between the educational consulting and legal consulting, I have worked on cases and/or educated nurses in every state but Vermont. I'm still working on that one. NHI provides paralegal support services as well as behind-the-scenes case review, expert testimony, cost projections, and life care planning in catastrophic injury cases. Now for my role as a nurse educator. It wasn't just in long-term care. In 2007, I became a full-time nursing professor to undergraduate nursing students at Indiana Wesleyan University. I then transitioned to the graduate nursing program in 2008, teaching students who were getting their master's degrees in nursing education, nursing administration, as well as a nurse practitioner. In late 2008, I became the chair of the geriatric nurse practitioner program at Indiana Wesleyan until the program was dissolved several years later. I continued to teach research in the program through 2020. Also in 2008, I started seeing patients in the outpatient setting in a free clinic in Marion, Indiana, and continued that over the next 15 years as well. From 20 13 through 2025, I continue to see patients in the outpatient, assisted living, acute rehabilitation, and long-term care settings as both the primary care provider, as well as a physical medicine and rehabilitation nurse practitioner. So that brings us to 2025 and FNP. Why did I take that leap? Well, first of all, I was becoming burnt out on traditional medicine. I was tired of ordering a pill for a symptom and not really fixing my patients' problems. Also, insurance would not allow me to do what I thought that my patients needed. In addition, at the first of this year, I started seeing a functional medicine practitioner myself because my hormones were low. I had brain fog, weight gain, and my anxiety was increased. I started on hormone replacement therapy and thought, okay, this is going to fix everything. But my next evaluation at the end of June showed that my hormones were even lower, which just seemed impossible. So I sought a second opinion through a different provider, and my hormones are now on the right track. Going through this process with functional medicine myself while obtaining my own certification has given me even more knowledge from a patient perspective, and I believe will make me even better at assessing and prescribing for my patients. So thank you for watching and learning more about me and FNP. In my next videos, I will be sharing helpful tips and information that will likely be beneficial to your health and wellness. So stay tuned.